When people age, their eyelids get heavy or gives them a tired look, and the brow typically drops down. Men have low brows to begin with. Women develop low brows with aging, and it gives them excess on the upper lids, and it starts to hide some of the eye to make it tired and closed up. When we do eyelid surgery, you have to take into account this brow ptosis, and if you don't, you're just going to take out too much skin. The brow is going to drop down even further and give women a masculine look. So a lot of times we'll do something that elevates the brow with a lateral temporal lift, and then we take out the extra skin above the eyelid, opens up the eye, and it brings up the lateral part, which is called lateral canthus, from a low sad look to a higher look, even if we're not doing the lower lid surgery.